thank you for joining us today. I'm really excited about this topic, building effective partnerships with schools. It's something I think many of us have felt was challenging over the course of our careers, and so having some folks here today that can share their lessons learned and strategies, I think is going to be really helpful. So the key points of contact for the Rural Webinar, Rural Learning Community are myself, Shannon Robshaw, Matt Buckman, Christina Paternoster, and Sarah Warner. We would invite you to contact us at any time with any ideas you may have about topics that you would like to see covered, any feedback on any of the webinars, or any other ideas that you may have to help us really grow the learning community as a peer-to-peer learning community, and so we really can generate more sharing between you all and not just have formal presentations. So we really would invite any recommendations around that. By signing up for the webinar today, you have been automatically signed on to our listserv, our ongoing listserv, where you will be emailed out recordings of the presentations as they're done, and occasionally other materials that we identify as valuable resources to the field. And so if you don't want to be on the listserv, just let any one of us, points of contact here, know, and we will remove you so you don't receive those emails. We also are trying to build up the learning platform, the learning management system that the University of Maryland has recently invested in, called Ideas at the Institute. And that's where we are maintaining the library of these webinars and other materials and resources to make available to the learning community. So I really would invite you all to sign up for that. It doesn't cost anything. You do have to create an account, which is just your email and a password, and then you can log in. You can access all the resources available to the rural learning community, and also there are a number of other learning communities available through that same platform that I think you may find valuable. And so I really would invite you to do that. And Tiara, if you could put up, there it is, there's the link that you need to go to right there in the chat box. And it only takes a couple of minutes to set up an account. And once you set it up one time and get logged in, then you go straight to the resources and don't have to, if you stay logged in, it's easier to get to things and easier. It's also a place where you can register for the ongoing webinars going forward. So I invite you to do that. If y'all would stay on the line just for a couple of minutes when we're done with the presentation, there'll be a very brief evaluation survey. We really would like to have your feedback to let us know what you think. So please stay on the line for that, and we'd appreciate your completing that. It only takes a couple of minutes. So let's see. We want to start out with kind of getting a handle. We've got a lot of people registered and 66 people currently on the line, so we really would like to understand who we're talking with so we can tailor our content a little bit. So if you could tell me how you would best describe your organization. We've got local education agencies, good. We've got family organizations. We've got mental health agencies, lots of family orgs. I would encourage you, please, if you take just a minute and just get in there and just let us know what kind of organization you would say you work for. It would be helpful so we can make sure that we kind of hit the points that we think might be most valuable for you. Community mental health, someone was saying in the prevention services in the chat box. All right. Well, I think we need to move on. Thank you, Tiara. Let's see. One other question is, how would you describe your role in the organization that you work for? And if you could just let us know here what your role is. Since the grant, PDs. Family support provider, because we have a lot of family organizations on the line. Good. Supervisors, executive leadership. Nice to see. Okay. All right, great. That looks great. Thank you. And I see some juvenile drug court, SOC coordinator. All right, great. Care management organization. That's very, very interesting. Okay, cool. Well, we're going to jump right into the content. I'm really, again, very excited today to have the speakers that we have. I'll let them introduce themselves a little more and give their backgrounds. But we've got Dennis Calcutt and Carrie Christian Coates from New Hampshire. We have Lisa Butler from Oregon, and we have David Baker from Texas. And so I'm going to turn it over to them and invite Dennis and Carrie to get started.
Thank you very much. As she mentioned, my name is Dennis Calcutt. I'm the project director for the Monadnock Region System of Care. And we have been at this now. We're in our 4th year of our implementation grant, and we had a planning grant prior to that. I'll let Carrie introduce herself.
Hi, Carrie Christian Coates. I'm the Director of Student Services for Conval School District, which is one of the school districts within the Monadnock region, and I am a member of the governance board for Monadnock System of Care, and am working with this group in this region to help with these issues.
So just to get you going now, I want to move to our first slide there, and the mountain you see is Monadnock. It is what our region is known for, and it is in essence and I noted there that it is what unites us as a region and what divides us as a region. Some would consider it to be the 2nd most climbed mountain in the world. Not a difficult climb, but a beautiful climb, and that's a painting of the mountain that was done and hangs in the region over at one of the hospitals where we have space that we use. But we are in the southwestern corner of New Hampshire. The region, it does get climbed so much as we're not far from Boston, and we're not too far from the New York metropolitan area either. So Carrie and I really are going to try to approach this as a conversation, and so you'll hear us going back and forth about pieces as we move along. And what we really have viewed our work, it has been really a step-by-step approach with our funding with SAMHSA. They've really helped us move further along this path of how do we integrate our work more with the schools, how do we help schools see themselves as an integral part of our system of care. And we also are highly aligned with the efforts that are happening statewide. And you would say that as a state we're sort of in our toddler stage. You know, we've moved out of infancy as a state in terms of our system of care work, and I think we've really benefited and learned a lot from the efforts of many of you across the country in terms of helping us understand what this work is like, and it really has allowed us to put our best foot forward. So the next thing we're going to get to is some questions for all of you, just to help you think a little bit more about this work within schools. So the first question is up there, and we just would love your answers to that question. You know, do you think schools have cultures that match the system of care values? Coming along in terms of your answers. But I think what we're seeing is consistent with what Carrie and I talked about as we sat down and started thinking about these questions and thinking about this presentation, is that and Carrie and I have had this conversation a lot, as she as someone who works within a school district, and I as the person directing the system of care approach is really have seen that we don't have similar cultures, and that's part of the challenge in our work. That's great. Thank you for your response to that. I think we can move on to the next question. You can see it there. Why is it difficult for schools to adopt more of a system of care approach? Hopefully my answers that you can choose from make sense there. They may be a little choppy, but I think you'll get the drift.
Yeah, see, it's the
We really appreciate your perspective. You might have heard Carrie just touching on that a little bit, but it's really interesting, and I think it speaks to some of the struggles we've had in our region and some of what we're attempting to do within some of the schools as we look to expand across a bigger part of our region too.
Well, we've also learned that how it's presented, the information is presented, depends on whether people are going to buy in or not.
So that's great. We can move on to the next slide then. Okay, I think it's my job to flip us to there we go. So we're in a rural region. I think that speaks to the presentation we're doing. But what we have found and what the region is really known for is collaboration. I think rural regions do have a lot of, there at times is a scarcity of resources within rural regions, and we start to see that collaboration really speaks to how we're going to do that. Many times, though, in the hubs of regions, so we are actually sitting in Keene, which is on one side of the mountain, and Carrie noted that her school district's within this region. It's on the other side of that mountain that you see. And we, sort of the interesting piece of this, Carrie lives on the Keene side, I live on the other side, and we flop back and forth when we actually drive past each other a lot, driving to work, crossing that region. But a big piece of what we've tried to do there, and you can see that in that second bullet, was really think about how do we make sure that we are focusing some of our resources outside of the hub. And because lots of people would say, well, the resources are in that hub of the biggest city in the region. Now, granted, you're in a rural region, so we're in Keene, and that has a population of 20 to 25,000 people. But you do see that the other parts of the region really suffer from a lack of resources, and you run into lots of other barriers to that. Okay, we'll move on to the next piece here.
And this part looks at the driving factors of the system of care relationship with school districts. We have many different relationships with juvenile justice, children's mental health, and all kinds of partners. Our relationships are grounded within this partnership. We've worked really hard at getting schools connected with the system of care. Some of this goes back to years of this region trying to keep the wraparound system of care mental health approach here in this region. We see that there's a consistent group of people that are continually trying to work on building these relationships and creating these positive environments both in school and in the community for children, the youth and families. New Hampshire has struggled since about 2008, when the state legislature significantly cut funding for mental health services. That's affected, we're starting to see the trickle down that's affected family and youth. So lots of the need for those services has been pushed down to the schools. So the System of Care project has really provided some support for the school district, both in district and outside into the communities.
And I also think that we have some of the scarcity of resources has created at times a confusion within organizations and within schools. I think most people, most families have seen that they know where to go to get some resources and some help. But what you also see is that you really have two different cultures within schools and within system of care. And our goal is really, can we get them to be closer? We're not necessarily saying that they are going to be exactly the same, but can we get them to be closer? And that scarcity of resources is really spoken to helping people understand that a system of care approach and the resources we're bringing to the region are not going to be limited to just that within the system of care. And you're going to be able to have the resources that existed prior to this, and this is in addition to that. We'll move on to the next slide. So what are we doing to build school partnerships? A big piece of this, and this has been, Carrie and her district has really led this effort. We have worked hard in terms of training some of the staff within the district. So within the district, the Conval School District, we've trained all of the individuals within that district in youth mental health first aid. The other piece that you see listed here is you talk about trust and open feedback. And so one of the things that we have done is really tried to create feedback loops and tried to instill those loops in whatever meeting, whatever environment that we're in. And what I mean by that is, especially in a new initiative, we're really pushing to help people understand that we want to hear from them, that we want to understand what about the system of care approach is confusing, what about the system of care approach or the wraparound work that we're doing is working, what isn't working. And what I try to say to people when I'm presenting to people is I'm going to ask you for that feedback 5 times. And what I'll find is it may be at the 5th time that someone's actually going to say, oh, I think he's really interested in telling us that, because most people don't provide feedback. And so we really solicit it, we really get it, and we also then really have to act upon it to make sure that the people giving us that feedback know that that feedback is critical. So that really has spoken to how we've started to build these new partnerships and relationships to strengthen them over time. Okay.
So the goals of our efforts, we presently, as I said earlier, have a wraparound coordinator that works within our Conval School District with specifically identified youth and family, and that's given us an opportunity to provide options that may not exist for our children and families within the school district. We've also seen that that's given us the ability to begin to change the culture and climate within the school district as it relates to this kind of work, and helping people within the school setting understand that we're not asking them to do something more, we're asking them to look at how families are welcomed as partners when we're thinking about student needs, and how we can be at the table together and not think of isolated opportunity that family and youth, depending on the youth's age, wouldn't be part of that process.
And a piece here that gets intertwined in this is communication, and we have really seen that old systems of communication and patterns of that communication have begun to change, but we still see it popping up, and I'll touch on this a little bit later in our slides. We still see it popping up as a struggle point, and specifically what we have in one of our partners within the state work as well as the regional work is NAMI New Hampshire. So we do have strong family peer support, and through Youth Move New Hampshire we have youth peer support to really support these families and these youth. But at times you're asking old systems or existing systems to start to change the way they think about this, and that's been a challenge for schools as well as it's been a challenge to help people to really change the way we think about those communication patterns.
The other piece of that, oh, sorry.
You can go ahead and touch on that.
I was going to go back to the other slide because I felt like it was important to identify the piece about the hats at the table. I think that what we're really working on in this region is when you're present at a table or in a wraparound, how do you leave your Director of Student Service hat outside the door and work in a collaborative way, but not compromise who you are as that professional participating in that process.
And that, again, that speaks to that old systems, how do we change the thinking about that process. The next slide there you can see I've got is who are the partners, and this is somewhat obvious, but family and youth, and we really try to emphasize and put that first because it's really trying to change the culture around this. Many times family and youth are not looked at as partners, and we have been very active from the start to really involve them throughout that. And we're proud to say that many of the families and youth that we started working with at the beginning of our planning process are still with us and working with us through this process, and it really has been wonderful. A key partner that came in, it's the county of Cheshire holds the grant, is the fiscal agent for the grant, but the county is also changing the way they think about this work and thinking about themselves as a real active partner. As we start to get closer to our sustainability efforts with respect to becoming a care management entity, and that's our goal. We don't know if we're going to get there yet, but we feel pretty confident. But also we're looking at an expansion grant as well. The county has really said we're looking at becoming a real resource for this work and carrying that work beyond just the immediate region, in the county's region, into the other parts of the area that really makes sense. But you're always looking for new partners, and you're looking to bring those people to the table, and you want to do that in respectful ways, and you want to do that in ways that really gets that feedback loop again. We want to hear what their experience is like. And a lot of times you may have talked to someone when you're in the planning grant, and then you come back to them again 2 years later, and they're sort of like, oh, you're still doing this work? And it's like, well, no, the sustainability efforts have really allowed us to start to think about doing this work permanently. And I think that's really been a wonderful aspect of this.
Right. I think just to emphasize the sustainability piece, what we're doing with this project, which I feel is really important for the consistency of the perspective, how the school district looks at this work, is talking about sustainability from the beginning of the project, so that we're not just talking about it when we're almost done, that right from the beginning, when we're introducing this concept, we're talking about how we're going to sustain that. And I think that's been a really effective part.
I would agree. What are the roles of the partners? You can see we've got them listed there, but I think that the big piece that you touch on at the start is, experts in their area, experts in their lived experience, their organizations, trusted community members.
A connection to children, youth, and families. That one thing, again, from the school perspective, is teachers and administrators, school nurses, school counselors have connections with youth and family, and we're trying to help them understand that all of those pieces play a part in this project.
So communication is critical.
Reconnecting and ensuring the partners know what's happening. Children, youth, and families understand that what we're offering, how they'll benefit from that. Setting goals, sharing the work. We talk a lot about the different organizations that are working with these families, and how do the goals that families are working on, how are they consistent, so that the message that they're getting is consistent from all of the different places, so that we're all working together, we're all using the same language, we're all communicating, so that there's understanding from the bottom up.
And I think what you find with communities like ours that have had different levels of experience with wraparound, and many people would say to us, and many people do say to us, that the use of the word wraparound is confusing, because I know what wraparound was like 10 years ago, 20 years ago, and this is different. And so it's a challenge for us to do that. And so we've had mixed success thus far, and we've re-engaged with a different communications company to help us tell this story. And we're feeling good about that next step, because with sustainability on the horizon and helping the broader community and expanding beyond our immediate region to do more work beyond that region, communication and communications with the broader population will be critical.
The next section is the struggles we've encountered, and I believe that one of the biggest ones is that old patterns emerge. similar to what Dennis was saying in regard to what wraparound actually means to people. We have dynamics of interagency team, wraparound team, what we used to do in the old days, what we do now, what's the same, what's different. That's been difficult. That's been something that continues to be an issue.
And you know, as you talk about this, you know, some of it gets into those first questions that we asked. The culture that I describe it from the perspective of we're on a bus moving in the same direction. We're heading down that path, but the cultures of the different organizations, the cultures of schools, the system of care values, they're not on that same plane. We're not even. And I don't think we're ever going to get completely there, but we are working hard to get closer to that. But you will continue to run into struggles, and some of those struggles are we fall back into our old ways of doing things, and people forget that system of care is here to stay. System of care and the work that we have going is really a great opportunity, but people still will fall back into, well, wait a minute, what's the school going to do for this, instead of saying, what are we as a community going to do for this work with these families and how we're going to pull that together.
Yeah, one of the other pieces around the struggle is that when of course we're talking about funding, and when we're all at the table together, there's still that dynamic, the old pattern dynamic of youth needs something, some sort of resource, and who around the table is going to provide that? Who's got the funding? There's still that pressure on the school district or juvenile justice or Division of Youth and Families, those funding places that get a lot of pressure. So we're slowly continuing from a school district perspective to kind of push back on that and ask, you know, what is this organization doing, or how is this organization helping?
And that's where the system of care really has allowed us to grow and allowed us to see this in a different perspective, because it's really a new opportunity. Okay, so what does success look like for us? You know, the big piece is that families and youth are involved and see their role as critical, and we've really worked hard on that, and we can only thank them for that, because I think what we've done is really said we're going to value that voice and we're going to continue to have that at the table, but they have really stuck with us and stayed with us and trusted us in that process, and that's been great.
There's great work that we're doing in the community, and we just need to be patient, and we just need to continue to try to move it forward as we're consistently evolving in this process and educating people and communicating to people about what it is that we're trying to do.
And we'd love to tell you, you know, in the next couple of years of how it's evolved even further, but, you know, thank you for your time.
Thanks so much, Carrie and Dennis. I do want to move into Lisa's presentation, but there were just a couple of questions that if we could maybe get a brief answer to, and then we'll move right into Lisa's. There were some things that came in the chat box. One was, the wraparound coordinator assigned to the school, is that a full-time role, and how is that funded?
It is a full-time role. It is funded currently. It's grant funded. However, what we are continuing to do is look at our coordinators as being connected to districts or connected to regions around districts, so that we really end up with more of a regional approach to it. And we also, you know, in a rural region, we start to cut down on costs, like we cut down on transportation costs. But it's tied to our long-term sustainability of the state's wraparound benefit that has been built. So that will be funded through the Medicaid benefit state plan amendment.
Great. Thank you for that. And then the other question was a question from Scott Bloom, who asked, are you looking at this model as preventative? And if so, what exactly are you preventing, and what outcomes are you showing?
I would say a lot of the outcome pieces are still to be seen, because our evaluation work is heavy and consistent. But from the preventative side of it is, I've really asked that question a lot, has been like, okay, how do we see system of care as preventative? When, as a state, we took the jump, and I say as a state because, New Hampshire is a small state. It's one little region isn't going to impact. We have to really work in collaboration. And what we have found is we have to think about how we're going to move some of these preventative pieces to the forefront. So we are doing some of that through looking at our broader funding within the becoming the care management entity and moving at the sustainability piece. But we're also looking at it, we're actually applying for an expansion grant to start to really touch on some of that preventative pieces by doing more of the multi-tiered systems and supports work within schools and partnering with schools for that. We're looking at introducing some wraparound for birth to 5 families. So it's how do we get further upstream has been a real question that many of us have been asking. I don't know if Carrie has anything else to touch on around that. No.
Okay, great. Well, that's a pretty broad perspective and kind of that prevention and intervention for those most serious in need and those, like you said, farther upstream. So thank you for sharing your thoughts on that. And thank you for your presentation, Carrie and Dennis. We really appreciate it. And hopefully we'll have time at the end after everyone is finished for some additional questions. But at this time, let's go ahead and move to Lisa Butler from Oregon.
Thank you for the introduction, and thanks for the opportunity to present on what we're doing here at Oregon Family Support Network. I'm Lisa Butler. I am the Family Support Specialist Director for Oregon Family Support Network. I'm also a mother of 4. My oldest son, who is 21 now, originally brought me to the work. We navigated every child serving system known to a family here in Oregon. He went through the wraparound process when, in the early days, when it was just a wraparound pilot site in Marion County where we live. And now my 15-year-old daughter keeps me fresh in the mental health system. So I'm happy to be presenting sort of on some of the exciting things that we're doing here in Oregon. During this presentation, I'm just going to tell you a little bit about who we are and what we do with families here in Oregon. And then as we get into the presentation, I'm really going to highlight some of the really innovative and creative programs and partnerships that we've built here and how that has grown and strengthened our partnerships with the schools. So Oregon Family Support Network is a nonprofit 501c organization. It's actually recognized by SAMHSA as a peer-run organization for family-run peers. It's a state chapter of the National Families of Federations Mental Health. So basically, all of us that work here are parents or caregivers raising children with emotional or behavioral health challenges. Which gives us that personal lived experience to support families in our community. OFSN's mission is we are families and youth working together to promote mental, behavioral, and emotional wellness for other families and youth through education and support. So just an overall sort of bird's eye view of what we do, broken up into categories. We provide one-on-one family peer support. So we will come alongside families who are working in different systems and different programs and use our lived experience to help families have a voice, help them navigate different systems. We also have our own training department, which we provide trainings to families and communities and partners on various different topics. Across the state, we put on different family events for families that helps to reduce isolation, build communities for these families who are raising children and youth with challenging issues. and we have support groups for families. Next, we're going to switch over to a question that'll help us start thinking about how our peer work is supporting our partnerships with schools. So just one question, how do family-run organizations have effective partnerships with schools? Offering trainings, one-on-one peer support, through system navigation, or all of the above? Okay, well that was unanimous. It looks like if everybody has put their answer in there, 100% have answered all of the above. Oh, through system navigation. Somebody changed their mind. That would be correct, all of the above. Family-run organizations have effective partnerships with schools by offering training and education in our community, offering one-on-one peer support, and through system navigation. Give a couple more seconds for people to respond if we need to. Okay, we can go back to the presentation. Thank you for taking a minute and thinking about that. So what I'm going to do now, so in the past, in Oregon, families could only access peer support the majority of the time through our wraparound process, and we really wanted to get ahead of that top 5% of families who qualify for wraparound. And so we, over the last couple of years, we have put together some of these different programs in partnership with different community partners to offer some support to families before they get before their needs are so complex and so intense. So what I'm going to do is just kind of talk about some of these. I'm going to go through and talk about each one of these programs and what they do, and then I'll discuss how these programs have supported our partnerships with the school district in accessing families and making these families stronger and more empowered to work through difficult situations. Our community-based family peer support program. This program really, the thinking behind it was really to give all families in the community access to peer support, regardless of what program or provider, if any, the family was connected to. We know that families begin to maybe identify something different about their families early on, but don't necessarily have the knowledge of what to do next. So the community-based peer support program is for any family in the community. There's a fairly large portion of it where it's insurance blind, and we're able to, it's a short-term support, so 30 to 60 days. Sometimes families will call and say, gosh, the school keeps calling me and they say that I need to get some therapy support for my child. Where can I do that? And we're able to sort of just help make that connection for them. Other families need more support that goes more towards 60 days and sometimes longer. But it really is the idea to get ahead of that and help families begin to learn how to have a voice, learn how to navigate these systems before their needs become so intense and so complex. The next program we have is called the Regional Family Support Specialist. This program supports families and communities in rural communities to support them in creating support groups and bring trainings. These programs, these are family partners that are placed across the state, and they cover large regions. Families can call these regional family support specialists with questions about IEPs or the school system or anything that they may be questioning. These family support specialists will connect those families in their community with resources that are already there. This also supports the systemic care governance structure and building meaningful family engagement in rural communities. So we're really looking to connect families with their local systemic care governance structure, and then not only connect them, but prepare them out of that, we're hoping to identify family members who would like to spring up support groups in those rural communities where there's just not a lot of support there for families. The next program that we have is called our Rapid Response. This is a partnership with a few different partners. We partner with Lines for Life, Youth Era, and Oregon Family Support. And this is a program where if a community has experienced a significant crisis, and their community mental health organization can reach out to Oregon Family Support Network, and we can go in and help them identify the needs of their community, this team, and provide some post-crisis support for them. It looks different in all different communities. It really depends on the community's needs. The next program is the Youth and Family Crisis Center. This is our crisis center here in Marion County. This is for all families, can come in and get a mental health assessment and be connected with peer support. We'll work with the family. Again, it's a short-term support, 30 to 60 days. That if the family is needing more long-term support, we of course then would connect them to something that was more long-term and sustainable according to their needs. And the last one is our Crisis and Transition Services. This is, again, another one-to-one peer support program. It's a short-term peer support for families whose youth are experiencing a mental health crisis or behavioral health and who would meet the criteria to be admitted to the hospital. We really want to try to support these families in the community. This can be accessed through the crisis centers and also through our school mental health or school social workers. So when we think about all of these sort of different and creative ways of reaching and supporting families, each one of these programs has really lended itself to helping us connect with the school systems. Out of these programs have come these different ways that we've really done great partnerships with our schools. Our rapid response team, Oregon has seen a significant rise on completed suicides, and particularly here in Marion County. And last year, we had quite a few deaths by suicide in September. And the rapid response team was able to partner with the school district here in Marion County and provide a series of speak-up sessions at each one of the high schools throughout the entire school year, where we came together. There was a panel of people. We invited teachers, students, parents, caregivers, everybody to these speak-up sessions, and we just had conversations about suicide. What is it? How do we talk about it? What can we do if we learn something about a friend or a student? And those were extremely successful. Again, we were invited to all of the high schools in Salem-Keizer School District. Out of our community-based program, we partnered with the Early Learning Hub and provided classes for parents called Positive Parenting. These were, I believe, 6-week classes, educational classes for parents that were attending a specific school, elementary school in our area. We provided these classes. These classes were provided in English and in Spanish. We had support for families to be able to bring their younger children. So we had youth activity leaders, which was extremely valuable for families to get that extra parenting education that they need. And then it also allowed us to build a very strong partnership with the elementary school. Also, out of our community-based program, we were able to host a back-to-school event, and what we did was offered an IEP and 504 training to families, and we offered this in both English and Spanish. Actually, we did 2 English and 2 Spanish. And then out of all of these different, over the last year, all of these things that we were doing in partnership with the school, we got invited to our expulsion school here in the area to be a part of their parent-teacher conferences, to just offer parent support as they came through to talk, to their students, teachers, which is really exciting. We've not been able to get to that place until recently, and it's really due to really thinking about how we can get ahead of, waiting for families to get at that acute or top 5% before we can start supporting them. And that's all I have for everybody today, so we have plenty of time for questions.
Great. Thank you so much, Lisa. That was really, really helpful and interesting. We do have a few questions that have come in while you were talking. The first one is from Colleen Igo. What mental health assessment tool do you use?
We don't do the mental health assessment. That's done by the Youth and Family Crisis Center. That's done by a clinician, and I don't know the actual name of it. I'm sorry.
Okay. There was a question from John Cole. Can you speak about the sustainability of the Crisis Center, staffing, fees, qualifications for those assessing, et cetera?
Yeah, I can't really speak to the qualifications. They are mental health. They're mental health associates, I believe. But the Youth and Family Crisis Center is actually pretty unique in the way that it was established. It came out of our governance structure as a community barrier for how families are accessing or the ability to access mental health services, mental health support. So the Youth and Family Crisis Center is supported through braided funding in our community. So the juvenile department, DHS, the county, everybody has a little bit of the financial responsibility.
Wow, that's really impressive. Cool. Colleen had another question. She said, do you work closely with the Student Assistance Program?
We do get some of our referrals. In Oregon, we have school-based therapy or school-based counseling through a provider, so we do get some of our referrals out of that. I'm not sure about a program that we have in our school systems called the Student Assistant Program. We work with social workers, our school social workers, and the school counselors.
Okay. Are there any other questions from participants? We have a few minutes. We want to take any more questions right now. And would you say, well, so Barbara is asking, do you use any materials in the support groups that have an EBP designation?
I'm sorry, that have I'm not...
Evidence-based practice designation?
Well, we do have a collaborative problem-solving group that we do, so we do have that. The support groups, often the support groups we do are just to bring families together. They do have an educational topic, but it could be anything from natural remedies to understanding the DD, the developmental disability process. It could be anything that the families are wanting to learn more about. It's really what the topic of those support groups are, and also to help reduce isolation for these families.
I had a question, Lisa. Carrie and Dennis talked a fair amount about just sort of the different culture between, school systems typically and the system of care type partnerships that are built. And I'm just wondering, in your work there in your interactions with the schools, has that been an issue, and how did you manage to sort of build that positive dynamic between your organization and those schools?
Yeah, I think that's a really good question. We have, and all the work that we're doing wasn't necessarily we did this and then this happened. This is an accumulation of years and years of just sort of, a drop of water in the bucket, if you will. So we have staff that have been sort of doing this advocacy inside school with families just naturally, and it's been over a course of time, and it's just become so effective, and the school systems and counties and local CCOs are starting to recognize that, and so then it gets put into our local contracts for our family partners to specifically be supporting families through the school system. That answer your
So
question?
Yeah, it does. I was just wondering if you would give any, if you had like a piece of advice on how to begin to build that positive interaction. Is there one particular thing that you would encourage people to keep mindful of, or?
Yeah, I think it's really just it's so it's such baby steps. So I think what we do, what our family partners do in communities is building relationships. We're always looking for that champion inside any system, whether it's the school system or the juvenile department, to connect with that person. And if you can find that champion who is able to believe and see your vision, that's where the work can continue to spread. It's patient work. It's incremental, not instantaneous, and it's persistent after sort of getting that buy-in with whatever system you're working with.
Thanks for that. It is long-term. It's a long haul.
Yeah.
It really can be. And finding the key individual that can be a champion and has credibility within whatever culture you're trying to influence.
Right.
I've seen that make such a difference. We have one other question from Tracy Pohl. She asked, is anyone looking at the connection to food insecurity / food access to food and mental health with youth? I don't know, y'all are working in that area, Lisa? Or
well, I mean, food is a natural neutralizer for anything, and so in any of our groups and trainings, it always comes with a meal. So we know that we have different in different parts of the state, supporting families more directly with access to food and food insecurities. So absolutely, we have that in mind.
Okay. And I would invite anyone else in that's signed on right now and listening, if you have any other information about, the connection to food insecurity and mental health, just go ahead and type that in the public chat box so people have access to that. But thank you, Lisa. That was really informative and helpful and inspirational. So
thank you.
It was nice hearing from you. So I think we're going to go ahead and move. I'm sorry, did you say something else? Okay. So I think we'll go ahead and move to David Baker from Texas, Heart of Texas region, and jump into his presentation, and then if we have time, we can open up to additional questions and answers to everyone at the end. So David, you want to jump in?
Hi, yes, thanks for having me. So my name is David Baker. I'm a licensed professional counselor in Texas, based out of Waco, Texas. And I work for what we call a local mental health authority. So we're the community mental health safety net, providing mental health services. Specifically, my division provides mental health services, and we have another division that provides developmental services. We have early childhood intervention. We provide services from birth to death, basically, and in all aspects of mental health, behavioral health, substance abuse, and developmental services. And so my specific division, we focus on children, adolescents, and families. So our agency is called the Clare Center for Families, and so although our identified clients may be a child or adolescent, we work with the entire family. And so today we're going to talk about school-based mental health in rural areas that we were able to start doing. So currently our agency serves 50-plus campuses in 10 districts. And those districts range from counties where the most populated city may be under 1,000 people to counties where the most populated city is 100,000. And so we have a good mix, actually, between rural and urban. And so it works pretty well for us in that way. And then when we're serving about 220 students in those districts, and we do that with a multiple variations of services. So in some of those schools, we have a tandem of a master's level therapist and a case manager. In some of those districts or campuses, we have master's level clinicians that are providing both the case management and the therapy. And then in some of those smaller areas, we have folks that are doing primarily case management. And those folks have bachelor's level education but are considered to be qualified mental health professionals through our training and experience. And so it's been great work doing that. We starting out in the 2015-2016 school year. Lisa had mentioned having a mental health champion, and we had a principal in one of the local elementary schools who was very forward-thinking, and he applied for, in the state of Texas, he applied for a Texas Title I priority school grant. What that means is that in Texas, a Title I priority school is one that is underperforming in state testing and grades and passing, and most of the time that's due to being in a low socioeconomic status group or area. And so this principal applied for a TIPS grant and received the grant, and in that grant funded several new programs, one of those being a school mental health program where he contracted with our agency to hire a full-time professional counselor and a full-time behavioral health case manager. And those folks were assigned to that campus. We had offices on that campus in which we were fully integrated. We were housed on the campus. We had Waco ISD badges, which means that gave us some credibility with the staff and parents because they saw that we were a part of the school. And they gave us access to Waco ISD systems, such as grading systems, behavior systems, report cards, and then we contracted to have a caseload of 30. So what that meant was that the school had its own resources in place for the majority of their children, but for those children who were in what we call their Tier 3, those kids who had the most significant behavioral health, mental health, sometimes even educational or physical health problems, allowed us to, sorry, I skipped ahead real quick, but allowed us to say, we'll take your 30 most intense kids and families, and we'll work with those so that you can turn your resources back to that general education population. And so that was the point of us being able to work with those 30 kids. And in doing so, we provided case management services, we provided psychiatric services, we provided therapy services such as cognitive behavior therapy, parent-child interaction therapy, crisis intervention. And one of the things that I'll mention later is we work year-round. So when the schools can't touch them over the summer or can't touch them over Christmas break or spring break, we're still there working with those children and families, and that was a great selling point for the schools. So while we were working on this one Waco ISD campus, our communities got together and decided to approach these needs in a system of care format. And so we titled that system of care Our Community, Our Future, with the goal of bringing the 4 pillars of child and adolescent services together. So we wanted to get representatives from the educational system. We wanted to get representatives from the juvenile justice system. We wanted to get representatives from child protective services and the mental health system. And we know that oftentimes we are working with the same children and families, but due to various red tape or bureaucracies or confidentialities or even not knowing what other systems do or not having those connections, we may be working with the same children in overlapping services or have gaps in services that each other can help fill. And so during that time, we applied for a SAMHSA grant, which we called Closing the Gaps. And we were granted that. We received that grant. And so in doing that, we were able to provide some services which included expanding our school-based mental health program. And so in doing that, in that system of care, we made it a purpose of our group, of our system of care, to include the rural perspective, to get those communities involved who may not always be involved due to the complexity of being out in a geographic area that is further away or being spread out geographically. And so we wanted to make sure that we included that perspective. And one of the ways we did that was we have a very vocal but amazing juvenile justice department in one of our smaller counties called Hill County. And she's a great advocate for the rural area, and so she wanted to make sure that that voice was heard, and through her voice we were able to provide a great deal of services out in that small area.
David,
Yes.
David, Shannon, I'm
Yes.
sorry to interject. I've seen a few people typing in the chat box that they're having a little difficulty hearing you.
Mm-hmm.
I'm wondering if you could get closer to the phone or try to speak more loudly. Great, thank you.
Yeah, you're welcome. So is this better?
I think so. Well, yes. So they're saying yes. Okay, thank you.
Okay. Yeah, you're fine. Thank you. So one of the ways that we grew was through partnership, and those partners included the 4 pillars of service providers. Really big was our juvenile justice providers. We have great juvenile justice programs in this area who really focus on the restoration piece, the rehabilitation piece, and not so much the punitive piece of what it takes to bring a child or adolescent from juvenile justice into being successful adults. And part of that is participating, understanding the mental health aspect, the socioeconomic aspect of their lives. And so being a part of this partnership has been really helpful. We've also had partnerships with our Child Protective Services here in Texas and our education pieces. We had a great champion in that original school principal, and then from there, that district's superintendent then reached out to other school districts and got their superintendents on board. We had a champion superintendent in one of our districts who was also the president of the local regional superintendents meeting and was very excited about the opportunity to work with mental health. And so he invited us to speak to the regional superintendents meeting, and that was amazing. That was a great opportunity to get in front of superintendents who were responsible for districts of 800 students throughout the entire district to districts with 15,000 students throughout the entire district, and throughout 6 various counties across the state. And so it was an amazing opportunity to have that credibility. And during that regional superintendents meeting, some of the superintendents that we worked with already spoke up and talked about the great value of having us there in their schools and their communities. And so really starting with those base relationships and then working our way into greater systems really helped. And then having those professional relationships. Many of the people on the system of care group with us went on to either increase their roles within their districts or move around districts, and having that good positive feedback really helps with the growth of school-based mental health in our area. And some of the selling points to school-based mental health is that the children that we work with become full clients of our local mental health authority, which means that they have access to case management, they have access to psychiatry, they have access to skills training, psychosocial rehab, family supports, peer partners, peer providers. They have access to crisis services. One of the great opportunities that we had, thanks to the SAMHSA grant, was we opened up a crisis youth respite house. So we can now provide youth respite to children and adolescents 13 to 18. and that's a 24-hour home that we were able to lease and staff in order to help prevent children or adolescents from having to unnecessarily go into the hospital or go into the juvenile justice system simply because of a temporary mental health or behavioral health crisis. So that's amazing. And then selling points also include that the schools are very open to allowing us to do intakes and provide services on campus, which means that in some of our areas, it may take a family an hour to get to one of our main offices or our main locations. That means a child could potentially miss a half day or even a full day of school just to become enrolled in services. But if we can provide those services on campus, that reduces absenteeism, that reduces barriers such as transportation, that also shows the ability for us as the mental health professionals to liaison between the family and the schools. And so there are a lot of great advantages to providing those services on campus. It means less time out of the classroom and reduced absences. Oftentimes we're also working with those children and their families to learn how to successfully navigate the education system, whether that's how to cope with symptoms of ADHD or depression or behavioral changes that will make them more successful in school, or advocating with the school to help develop an individual educational program or behavior intervention program or a 504 plan. And so that really helps that we can be there on campus and bridge the gaps between the schools and the children and families. Our staff work year-round, as I mentioned before, so they can touch those children and families when school is out or after school hours. During school days, we take the opportunity to do some skills training and do some learning on how to be successful in coping. When school is out, we're really able to focus in the family environment, in the home environment, and out in the community, and not only teach some of those skills, but actually help a student practice those in vivo. And so that's a really great opportunity there as well. We provide crisis services on those campuses and in the community. Those can be to kids or children or students who are clients of our agency or non-clients. If a person is in crisis, we're there to help. We also provide parent and staff trainings such as youth mental health first aid or specific content trainings. We also provide nurturing parenting trainings and therapies such as parent-child interaction therapy. We act as a liaison between the school and the family and other systems such as juvenile justice, such as child protective services. And then we collect data. My staff collects data and we turn it over to the University of Texas. And so the University of Texas analyzes that data and puts out biannual and annual reports. And the name of that institute is the Texas Institute for Excellence in Mental Health. They do a great job for us. They collect the NOMS data for us. We input it and they collect it and analyze it and send it on to SAMHSA. And so that's terrific partnership there as well. Some of the barriers that we've run into, oftentimes in schools, when schools are built, they're not always built with the idea of expanding dedicated space, confidential space, not only dedicated confidential space, but space that is welcoming to a child to be able to participate in therapeutic services. Parental or guardian support. A lot of times our parents and guardians are not involved in their children's lives, and that's part of the reason why those children are suffering and having such a hard time. So engaging those families. The referral process can be difficult. Knowing who should refer, what type of child to refer, what needs we can best help with. Communication from the top down. So we may have contracts signed with the district by a superintendent or by a representative, but the information may not be clearly communicated to what I call the gatekeepers, those men and women who are at the front desk, who buzz the doors open, who call the children to come see us, who allow us on their campus. They may not always know who we are or why we're there. And so sometimes a little bit of education with them, and then just going in, being a smiling face, being a warm person, and acting like we're supposed to be there is quite beneficial. But we can get past that. Territorialism. And I don't know about other states and other education systems, but in Texas, our school counselors really have a great deal of scheduling that they do, and guidance counseling as far as in high school, as far as, you know, what do I need to do to apply to college? What do I need to do to complete a FAFSA? What do I need to do to get into technical school? But most of the time, they're not actually trained mental health counselors. And so we can come in and provide that service and close that gap as well. And so I'm going to go back a slide here. And then oftentimes money is a barrier, as in any situation. Any service that's provided has to be funded. And so that's the next step to talk about is sustainability. We're coming into the 4th year of our SAMHSA grant, and so the 4th and final year. As with all grants, now what do we do? What do we do to sustain the wonderful quality services that we're able to provide as a community? How do we sustain that? One of the ways that we have been able to do that is entering into professional service agreements with the school districts. So each school district has the opportunity to help fund the services that we're providing. And across the 10 districts right now, we're receiving $225,000 in contributions. That is about a quarter of our budget at this time, but that's a quarter more than we had when we started the grant. And so that really helps. Also, we've begun applying for new grants and entering in partnerships with others who are applying for grants. Not only federal grants, but state grants or Department of Justice grants, as well as county grants. And then we're receiving monies from local benefactors and foundations. And then as the local mental health authority in Texas, we can bill our Texas Medicaid for the majority of services that we provide as long as that child is covered under Medicaid. We can also bill private insurances if they cover the services that we provide. And so future directions, we'd love to be in every school and every campus that we can. One of the great needs that we have is telehealth in schools. So although we can provide all of the case management services, we can provide the therapy services, we can provide the peer partner services, we can participate in IEPs, we can participate in 504s. The one time that a child or family may need to miss school to get a service is in psychiatry. So at this time, we're really looking at how can we move into providing telehealth in schools so that those children do not have to leave school and miss school. And then I don't know how much knowledge there is out there right now but our agency is working to become a certified community behavioral health clinic, which is a designation that would lead to new and various ways of funding, and so those are our future directions that we're going.
Thank you, David.
So,
that's really
questions?
fascinating, really interesting.
Yeah.
We do have a couple of questions, and I'm going to start with the one related to Medicaid because I wanted to encourage you to talk a little more about that too, and kind of what proportion, how much you can bill for. You said, most of your services you can bill for if their child is covered by Medicaid. But the Barbara's question was, how are Medicaid funds used for mental health services in the school? Are there waivers which have similar services and work in the schools? If yes, how is it decided which services will be used? So if you could just kind of talk through y'all's use of Medicaid to support, that would be helpful.
Sure. So in Texas, as a local mental health authority, our Texas Medicaid system will actually cover case management services. So they'll pay for case management services. They'll pay for psychosocial rehab services, which means skills training, medication management and supports. Medicaid will pay for certain therapies such as CBT, cognitive behavior therapy. We'll actually pay for play therapy. We'll pay for trauma-focused CBT, parent-child interaction therapy. It will pay some services for a peer partner or what we call family partner. And so as long as those services meet the state definition requirements, then we can bill Medicaid for that. The only time we cannot bill Medicaid is if the child is in a hospital setting or in a detainment. So if they're currently detained in a juvenile justice setting, then we can't bill for that. But Medicaid does allow us to bill for services that we provide in the schools, in the home, in community settings, in our offices, as long as that child is covered under Medicaid. We do have Medicaid. Go ahead. I'm sorry.
Oh, no. Go ahead. I'll ask my question when you're done. You may answer it. Okay.
We do have some waiver programs. The biggest one is called Youth Empowerment Services. It's a YES waiver program. That waiver program is for children who are at risk of being placed outside of the home due to needing residential treatment, multiple psychiatric hospitalizations, juvenile justice placement. My team doesn't actually work with those kids because you have to have specialized wraparound training in order to provide those services. But our agency as a whole does provide those services.
I was going to ask, so what would you say, and you may not have this off the top of your head, but so the staffing structure and the services that you described, in terms of those staff that are housed within the schools, what does Medicaid basically cover the staffing costs, or how short is that?
So it really depends on our billing, so our times with those students. Mm-hmm. And our agency as a whole, because we're the community mental health clinic, outside of school-based services, probably 90% of our children are covered under Medicaid. Our school-based services actually are a little bit different because the school refers those children to us. And so those children may have private insurance or may be an income level where they don't qualify for Medicaid or CHIP. Mm-hmm. And so the Medicaid services, I would say probably cover 60-65% of the services that we provide. Okay. And we have the opportunity to do that as the local mental health authority, whereas a private provider or somebody who was only able to, for instance, a private provider, Medicaid would not cover a case management service. Medicaid, private insurances, they don't have any clue what case management services is outside of being a local mental health authority. I don't know if I can explain that very well, honestly.
No, that makes sense. That's very helpful. I appreciate that. And Leah has kind of a follow-up question. She says, with the sustainability funds from the school districts, are those coming from legislative dollars or from district funds?
Those are district funds.
Okay. So that just comes right out of their budget?
Yes.
Okay. And then we had a question from Crystal. asking what assessments are being done with youth entering into juvenile justice, YLS or MMPI?
Oh, that's a good question. There are some assessments that are being done. I'm not fully aware of what those are.
Okay. Well, we'll continue taking questions for David, but we've got about 10 minutes left maybe, and so if there are questions for any of the previous presenters, I would invite those at this time also. Just put your type of questions in the chat box, and we can see what we can respond to. Does anybody else have any more questions? It's really fascinating, Dave, that y'all were able to scale up in a relatively short period of time, it sounds like. I mean, how long was it between your working with that first school and, like, how long ago did that get started?
So we started with that first school at the end of the 2015-2016 school year. And we're entering into our 4th year now. But we had most of our current partners within the first 3 years.
That's really impressive.
Yeah,
I mean, it seems like you had just built on a lot of very deliberate partnership building, you know, that you had that base to start with. Is that accurate?
Yes. We built our system of care on what we found to be there were several smaller groups meeting to discuss the same gaps in services. And so what we try to do is bring all of those groups together at one table. And that really did, it really was those one-on-one relationships and those personal relationships, those professional relationships that expanded that. You know, that adage is so true. It's not always what you know as much as who you know, and who will champion your cause, you know, who will advocate the cause.
Well, I think that's been a consistent message out of all three of the presentations today, that it really is about building those relationships, finding champions within, you know, the cultures or the agencies that you're trying to partner with, and investing in that, you know, over a period of time, that it doesn't happen quickly. So I think it's, you know, it's good for us all to just remember that it is, you know, it's a long-term effort. It's nothing that you can just, you know, turn on a dime and stand up super quickly. So that's been really interesting to hear. I mean, concretely how y'all have done that. Okay, so I think there was a question about sending out slides. Yes, we are going to send out the slides to the listserv, and you can also download them right now in the files box below the chat box. Leah has another follow-up with those sustainability funds. Do you have any requirements or metrics for matching? Do you have, or do districts fund if they have money available?
Yes, so the $225 is actual dollars. And then for those districts who cannot provide actual dollars, we also do a match. And so we'll match space, or we'll match resources, whether that's personnel resources or papers and pens or printers or
okay.
Wi-Fi usage.
So whatever they have available to put towards
yes.
their share, or whatever you want to call it. Okay, well, good. Well, that was, this has been just really informative, and I hope encouraging to everyone on the line. Certainly to me, it's been great information to hear about concretely how, you know, y'all are working there on the ground and building those strong partnerships with the local schools. So I want to thank everyone, all of the presenters again. And we have, I believe, on the last slide, email addresses for everyone that spoke today. And so, you know, if you have additional follow-up questions, I'm sure our presenters would be willing to engage with you around those questions. So I encourage you to be in touch. And again, we're going to be doing the very, very brief little evaluation survey at the end of the webinar. Please, we'd appreciate your you're filling that out. And I would invite any personal comments. My email was on one of the earlier slides. Any feedback you want to give me directly or any suggestions for new topics, I would welcome that as well. And I appreciate everyone's time today, and I think Tiara is going to put up the evaluation survey. So thank you very much.